Welcome back. Thank you so much for staying with Monday Special, where we're talking about epilepsy. A lot of you are already sending your questions in. Let's see what some of you are saying or asking on Twitter before we move on to the demonstration tonight. I think we can bring those boards up. Okay, they're being prepared, and in just a few moments we'll have a demonstration on what can you do or what do you do when someone is having an epileptic fit. We'll be able to show that to you so that you're not so helpless next time. Okay, on Twitter, at Maverick Nyambu says, what types of epilepsy are there? What are the absent seizures? Does musical therapy and medical marijuana ease epilepsy? We'll try and ask the doctor to keep those questions in mind. At Irene Cristino says, epilepsy is a condition and not a disease, so guys should start understanding the victims. Okay. And then at Chege, I think HD says, my dad has been epileptic and disabled for over 40 years. Despite all, he has managed to raise us. He's truly inspirational. Oh, that's great. And the last one for the moment, Jaffes Ngumbi says, I also had some problems after I was attacked by thugs, but I've managed for the last 3 years without seizures. Thank you for sharing that. Before the demonstration, a little bit about the musical therapy, medical marijuana, the questions that they were asking before. What do you have to say about that?
Well, clearly you can see that epilepsy can have triggers. So there are certain things or events that can make you get the seizures. Okay. And Sitara did mention feeling hungry, exerting yourself. And in the same vein, then it means that the things that will calm you or make you feel better will help you. Okay. Isn't it?
So different triggers for different people and also different ways of dealing with it for different people.
Yes. And for adolescents, it's pretty tricky because they want freedom. They may want to not use the drugs. They may want to go out the whole night. And the lights in the disco or the alcohol or the long periods of starvation may be an issue. Just before the demonstration, tell us about flash photography and how that is such a trigger for epilepsy. Yeah, so one of the big triggers is really flashing light. And essentially what it means that anything like flash photography or TV or computers may actually trigger epilepsy for some people. And one of the tests that they do during electroencephalography is actually to try and trigger that with flashing lights and see if that happens. If that happens. Okay, there's still a few other questions around pregnancy and that kind of thing which people are asking. And there's marijuana too. And there's okay, does medical marijuana work? Because yes, there have been a lot of conversations recently about marijuana. And the thinking is that there's an extract of the marijuana plant called the dihydrocannabidiol, which is really not psychoactive, but it's thought to be effective. In Kenya, here at Kenyatta University, we want to do a trial for complex epilepsies, and there is a possibility. So you test it. Please let us know as soon as you have the results of that, so that there's clarity. Good. Okay, so now Sitawa is and the Dr. Guerra are going to demonstrate, and of course Charles will also be involved. When someone has a seizure or a fit, what do you do? So maybe you can both, the three of you can take us through what happens. Of course, I'll treat you with care. So typically someone falls down like she has. Is that correct? Yes, true. And they'll have jerky movement. And of course, the first thing you want to do is shout for help. Because you may need help, and just make sure it's a safe environment. Sorry, who shouts for help? You, as a person approaching. You'll always need help. Anyway. So sure. But not everyone's screaming. Because that's what normally happens half the time. Oh, everyone starts screaming and there's panic and there's a stampede. So that's important. Make sure the environment is safe, and then the next thing to do is to try and position the person in a recovery position, which is normally lying on your left. And with the hand placed like that, Star is doing very well. And the arm position that way. That ensures that the airway is clear. And so on the left, not the right, does it matter? Well, if you're right-handed, you know, you want to leave that to be available. What you'll assume that most people will be. But really, you want to be sure that the airway is patterned. You want to be sure that they're in a safe position. And then that's it. That's it. Let the seizure run its course. Usually it's a few seconds to some few minutes. Obviously, if it takes long, then that's an issue. The things that you must not do is to try and restrain the person, try and put something in the mouth. I was just going to ask, because there's a I don't know if it's a myth, but someone says put a spoon in your mouth. Don't put anything in the mouth. In fact, that may really mess up things. You may cause trauma, and you may interfere with the breathing process. Don't pour anything on the patient. In some communities, they actually pour is kerosene, or the eldest person in the environment actually pees on the patient. Don't do anything.
Or very cold water.
Or very cold water, because it's like trying to shock you out of the fit. But none of that works. Does it make it worse?
No, you may actually worsen the state, because you may drown the patient.
Yeah, and usually you say the fit lasts a few seconds.
Most fits last a few seconds to minutes. If it takes long, then another intervention will be called for, and that would be medical. Some patients will normally have a spray, and you can really spray that in the nostril. For younger people, you may have some medicine. You can pop up the other side, the rectal side, but that rarely happens, honestly.
Okay, so if a person is foaming, I mean, just let them live up it. Maybe,
Yes, let the seizure run its course.
And then after that, they usually get up and they're okay?
They may not necessarily get up immediately. So, and some patients may, or some people may actually pee on themselves or pass stool. And then they may get into deep sleep. Others may wake up shortly after. And that's why it's important. You place them on a recovery position, make sure it's a safe environment, and then just...
Are the seizures painful? Maybe I can ask Charles and Sitawa. Charles, are they painful? Oh yeah, you can stand up. Thank you. He treated you with they both did.
Yes, thank you.
Charles, are they painful, or you don't even know?
Not painful, but sometimes you find somebody, they say, bite themselves. Maybe your tongue or something to do with that. That's why you find people, they do put something.
So that to prevent...
So that you cannot bite yourself.
But it makes it worse.
But it's worse. So it's better just to position somebody to the normal place, so that he can get proper breathing. Then you find you stay normal. I will invite Hussein Mohammed on set shortly. He's the one who said he wants to come. I think he's feeling like he's missing out on the conversation. So he can come in as I ask. Sitawa already told us a little bit about what triggers her. She says when she's hungry, or for you, what is it that triggers your epileptic seizures? Myself, let's say, I told you when I'm angry. With something. So when I go to sleep, you find somebody like if you are dreaming or doing something, that's when it triggers me.
That's when you trigger. But have they reduced over time?
Yeah, already, because I've dealt with first with Dr. Robati, and now I'm dealing with still Professor Robati, whom I can say they have done me.
They've done a lot of... Before I rope Hussein into this discussion, can we quickly go into medication? What kind of medication do people with epilepsy take? I've heard you mention medicine and medication. Tell us a little bit about that, doctor.
Well, most of the medication for epilepsy is an attempt to reduce the overdrive in electrical activity. So for some people, initially they may make you feel sedated, but that wears out. And there are all sorts of drugs that are really easily available, like phenobarb, carbamazepine. It's a whole range of them. And they are fairly priced, honestly. Awareness, even in the health system, means that sometimes, many times actually, they are not available, even in our dispensaries or health centers. And that's a tragedy, because these are things that should really be accessible to people with epilepsy.
Other than medication, also just the support system. Because I can be on meds and meds and meds, but if I'm not in a good environment where first I understand and acknowledge that I have epilepsy and I have a good support system around me, then that is a trigger. Then yes, I have medication, but because I don't have I have something that is triggering, then I'll keep getting the seizure.
And in a moment, we'd like to hear about the work that the organizations you're in are doing. Hussein?
More or less was asked here, but were you saying nothing should be put in the mouth, in the position she was in? Many have always raised this question. He's talked about it, about biting the tongue. Now, that happens usually, and if it happens, you're just supposed to leave it like that.
Sorry. Go ahead. I've heard this over and over again, that no one has ever bit their tongue to the point of biting it and oh my God, my tongue fell and it went and went. But what Dr. was talking about earlier is more important, that my air circulation is good and also. And if I fall down, I have marks all over my legs because of sometimes I've fallen down in places where it's rough and all that. So the same sort of pain someone will feel because they beat their tongue is more or less what I'll feel when I'm finally back and I'm, oh my God, my leg or, you know, my back.
Oh, so your concern was maybe the biting of the...
Bite of the tongue. And I want to get this straight.
And chances are you will not stop it.
There's nothing you can do.
No, there's nothing you can do.
And you've said very clearly, and I want to go back there for a bit, the position she was in, putting her in that position, I mean, lying on your left side.
Yes.
That's it. There's nothing else you're supposed to do.
That's it. Just position her properly, make sure in a safe environment.
Don't put a blanket over her, nothing. Don't try and cover her.
Now, this is how, I mean, excuse my ignorance here, but how long it may last, it doesn't matter how long it lasts or whatever. Just don't do anything, just...
So, you appreciate that we've said that most of it lasts for a few seconds or minutes. But again, the first move is to ask for help, isn't it?
Yeah.
And the hope is that if it ever progresses further, you should have some medical assistance. And so the various interventions for when it is persistent are those that I've spoken about, like you know, some medicine to pop up.
Sorry. Someone is calling Charles and saying, I can see you on TV.
Charles had to pick up his phone.
So he had to pick up his phone. Sorry about that. Okay.
Rarely happens in live TV, but Charles has done it. Anyway, there's no problem, Charles. You were saying this.
Okay,
So you're saying, I mean, it's something that can concern people if it lasts long, and you're sitting there and there's nothing you can do. Just putting them in this position, you just.
Yeah, so
you're calling for help. I mean,
I understand the helplessness that, that people will have, and essentially one way of empowering people with epilepsy is that they have these sprays, you know, drugs that we call that can actually stop the seizures. For younger people, there are drugs that you can pop up the rectum, and they help to cease the seizure. But this is rarely necessary because most fits will last for a short time and will stop.
We need to run through questions really quickly because I know we're doing badly for time. So someone is asking, there was a question earlier that someone was saying she has a brother who suffers fits only at night and never during the day, and they've been having this since they were 15 and they're now 27. Could that be epilepsy?
Well, there's a certain range of epilepsies that actually occur at night and refer to them as nocturnal epilepsies. They do require treatment, and if you get the right medicine, actually you can be free of those nocturnal seizures.
All right. You can be free of them. And then someone else is asking how it affects pregnant women. Can it affect the child? Can it affect the... Oh, wow. Charles is using the phone. Charles is phone. I think you have to switch it off. Yeah,
please.
Don't mind.
So, your question, of course, is does it affect pregnancy? So, one, you will not want seizures to happen at any time in your life, isn't it? Now, pregnancy is a bit more complicated because now you're married. You have another life you're looking after. And think of epilepsy as an overdrive in brain activity. And essentially, if it's in muscle activity, then you get tired, you get exhausted, The brain also gets exhausted, you know? And blood supply becomes an issue.
So it can affect the unborn child?
It can affect the unborn child. And the complication is that some of the drugs that we need to use can also affect the baby.
All right. And then again, very quickly, others are saying that pregnancy or sex is the cure for epilepsy. Is that another myth?
You want to answer that?
Yeah, that is amazing. It's some of the complaints and even stories that we've had that a lot of people feel that if you have sex with someone who has epilepsy, especially a lady who has epilepsy, then she'll stop getting the seizures. And so we've had many cases of girls being raped as a way of people, you know,
trying to cure them.
Trying to cure them.
So that's a huge misconception.
It's a huge
Okay. I think that's important to bring out because that's really terrible. It's important that I think people know that that's completely a myth and doesn't apply. Hussein, you have a few more questions?
Yeah, I mean, talking about pregnancy, someone is a bit more direct, saying, Googling about it broke my heart because he was talking of it increasing the chances of getting disabled children, and I'm yet to get kids. Is this true?
Well, you know, you have to look at Google as a marketplace. You're not going to ask anybody questions about problems. And so some of the feedback you get, you have to take with a pinch of salt. That's not true as far as I know. Yes.
Someone else here says, I have a daughter who's 6 years old. She starts to laugh and then she falls down for like 1 minute. Could that be epilepsy?
That could be epilepsy. And like I said, epilepsy manifests in different ways. We said it can be subtle. Somebody asked about absence seizures. That's just a staring gaze. You look like you're daydreaming and then you go off and back. And so there are all sorts of manifestations.
There's excess stress in the world we live in. People get really stressed in the workplace. Your jobs are stressful. Your life is stressful. How much stress? Because you say there is stress-related epilepsy. At what point does it trigger a fit?
Well, I didn't quite exactly say the stress-related epilepsy, but stress can be a trigger for seizures for people who have epilepsy.
I think a lot of people confuse causes and triggers. So causes is what makes you start having it in the first place. And then a trigger is something that makes it recurrent. So like what I was talking about, lack of drugs or food or the flashing lights, those are triggers. So if any of those things were to happen now, because I already have something that caused it in the first place, then this is more likely to make me have a seizure.
Can you tell when you're about to have a seizure?
Yes, so something called an aura. So I'd say almost 80% of the time I'd normally feel, for me it's normally a funny pain at the back of my head. So I'd either try to pull someone or sit down or something of the sort. So especially if I'm around people who know,
you can alert them.
I alert them so they know when I start pulling them, they'll know, something's about to happen.
Okay, we're completely out of time. I don't know if you have any other questions. There's so many questions, but I think we'll send them to you so that you can go through them. A little bit, very, very quickly on the work that you're all doing in terms of raising awareness about epilepsy, Sitawa.
Okay, cool. So I run an organization called My Mind, My Funk, and what we do is provide information and support for people living with epilepsy. We have the free SMS line, which is 22214, and so it's a text line, so any questions from anywhere across the country, people looking for doctors or any linkages where they can get help and information for epilepsy, they just send that through and we'll be able to assist them.
Okay, great. That's what got you in top 40 under 40, I think.
Yes.
Thank you.
Well, we run a network of clinics called Ubuntu Affairs that really helps to help people with epilepsy access drugs in rural areas and informal urban settlements. We are all part of the National Epilepsy Coordination Committee, which really brings together different stakeholders in an attempt to rationalize epilepsy interventions, epilepsy strategies and awareness. And then I teach at the university and we are doing research on epilepsy.
Any way people can reach you, or any websites or any information? No. Okay, maybe they'll reach you through Sitawa's.
I think so, yeah.
Okay, but I think
but there's a National Epilepsy Coordination website. There's Afia Research Africa website.
Okay, so just maybe Google epilepsy groups in Kenya and it should come up.
Certainly.
All right. Your parting words, Charles?
I'm a mechanic and still I'm a rider. Like now I'm having my bike. But epileptic is not something to say that you cannot do anything. I do even electric work. And you find me up in some of the buildings doing
wonderful.
But if you concentrate on medicine, it controls. That's what I say. Because since I started dealing with this Dr. Robati, since that time I have been dealing with her, and now I'm dealing with still Dr. Kyoy. And if I go and explain how I'm feeling, they can add me because I use those medicines called phenobarbital. Those which I'm given. So before I was using two, just at night. And when I went and said I'm started feeling like if I'm going to have it, then Dr. Kyoy said you have to add
another one.
Okay, fine. So I was given three.
All right.
So so he told me even I can told you to add even to 5. unless now you concentrate on this.
That's an important message. If you take your medicine, you can do well. If you have a social support system, if you avoid the triggers, then you're just like anybody else.
Okay. We have so many questions, completely out of time, but thank you so much.
Thank you.
Before we leave, people are requesting for one more demonstration. So the same demonstration, you can just talk us through it, and then we'll have to wind up. But that's really all the time we have. Like we said, we'll pass on the information for all the questions to all of you, and you can see how you can help these people. But as Hussein and I wind up, if you could just give us the demonstration one more time.
One more time, yeah.
And then we'll leave.
So remember, our demonstration showcases just one form of epilepsy, the one that is jerky and somebody loses consciousness. But it comes in different forms. Usually, of course, you'll expect the person would fall and lose consciousness, and the jerky movements will be happening. And the thing to do is, of course, you've asked for help and you've made sure you're safe, and then is to try and position your person in a left recovery position. Okay? If you place the knee this way, then that helps to put in balance, otherwise they'll fall over to the other side. And then you're not helping me this time, then that's there, okay?
That way.
And that way. Then you let that take its course. Of course, sometimes during the movement they may move over, but just try and
put them back in that
position. Stay with them until the seizure goes through its course.
All right. Okay. We have one more break, then we'll come back and wind up. Stay with us.
That's right. Okay.